What is our muscle test going to be? And we're going to do this over the sheet.
Extending the hip.
Go ahead and push your hand. Push your hand. Push your leg into my hand. You can feel the borders. You can feel where maximus falls off onto medius right there. And relax. And if what's another muscle test we can do?
Abduction.
Abduction. So knee up against there. Go ahead and push your leg against my knee. Perfect. And relax. If I wanted to find that lower insertion on the gluteal tuberosity for the lower fibers of glute max, I can have her adduct. So I'll just place my hand here. Go ahead and push against my hand. It's right there. There it is. And relax. Good job. So I usually do myofascial release for the glutes over the drape because a lot of it, you know, you can grab chunks for skin rolling. It just feels a little uncomfortable and a little strange directly on the tissue. So we do it over the drape. I'm going to pull your shirt up. So most of it is going to be, instead of that flat palm torquing we don't really want to do that on the glute. So we use an open fist. Make sure to focus also all along that SI region. We're going to treat today in a prone position, but you can also treat the glutes in a side lying position. But we don't know that draping, so prone is good. When you feel areas of tension, you can also go ahead and grab. How's that? Is that comfortable for you? Mm-hmm. Do you feel like I'm grabbing booty versus treating glutes?
No.
Nope. My intention is to treat muscle tissue, so we are treating glutes. We are not grabbing booty. Very different things. That's what working over the drape also helps. You can do this entire treatment over the drape if you have someone who's a little uncomfortable with having this area worked, but still would like you to work it. They're like getting comfortable with the idea and say, well, today we can do it over the drape, and then next time maybe we, remove it. How long you do your myofascial release for?
10 minutes minimum.
10 minutes minimum. We're going to say we did 10 minutes. We didn't, but it's okay. Nice, tight drape. Keep you tidy for the camera. Oh, thanks. Remember, none of this. The glute muscles are multi-directional, multi-pennate muscles, so you can go all different directions, my stroke. This way, all around. Using a palm ironing effleurage. And you'll be able to feel where the tension is, and it's probably going to be along this SI region. You can use the open fist if you want to. Is the pressure comfortable? Mm-hmm. Make sure you get the lateral portion. So I'm using a forearm with this one. Glutes can take a lot of pressure. Can you take more pressure?
Yeah.
Yeah.
Feels really good on the side.
Those neglected medius and minimus. Not using the elbow at all. This is all forearm. Just like hamstrings with these deep muscles, just do a lot of effleurage. Does this move look familiar? From your Swedish? Twisty fisty. After you've softened it up, again, you can do a lot more. Very similar to your Swedish routine, coming from that greater trochanter, you can do pizza lines. But instead of doing 1, 2, and 3, you can do a lot more and treat as you find. Even though I don't use my thumbs or fingers to treat, I still use them to locate trigger points. Use a fist. Nice deep breath in. On her exhale, I'm going to apply pressure. You could use an elbow if you feel comfortable, just like in the hamstring. Find it, elbow braced by your opposite hand. How long are we holding our trigger points for?
8 to 12.
8 to 12. Fill its width. So. Find, treat, all the same way. Make sure you get super lateral with it. You can get low into a squat and treat that way. Sorry. This time I ain't going to use an elbow. I can use a fist if I want to.
What's the best way to kind of make that seamless when you're like coming off of using your forearm and going into another?
So like an effleurage with a forearm into another effleurage?
I feel like that's where I tend to get choppy a little bit.
Kind of like that. Keep getting deeper and deeper with your effleurages. So we've been targeting glute max. When we shift and get deeper and deeper on the lateral portion, we're targeting medius and minimus. We would just continue on with this pattern, this treatment style, until we get deep enough to treat piriformis. Now piriformis is kind of cool. You guys remember how to find it?
Greater.
Yep, sacrum, greater trochanter. It's right there in the middle. So my fist is right on her piriformis. So we can do a little active release.
With our muscle testing, do we have to identify that first?
For that one, it's so deep. So after you've treated it, if you use the pinky and the thumb to find it. You can also do this over the drape as well. Get more comfortable with it. Do some dynamic static. So piriformis right now is activated. Her femur is in lateral rotation, even though her foot is crossing midline. If I wanted to take it into medial rotation, so stretch it out, and take her foot out this way.
That feels good.
Was it too much when we went into lateral rotation?
That was good.
Okay. You can also get glute medius this way, because remember, it also does medial and lateral rotation, and so does minimus. So we just get super lateral. Forearm in there. Try and keep it covered for the camera. Same. And I'll feel the areas of tension. I can just give her foot a little bounce. After I do any active release, I just do some more effleurage. Calm it down, because that can be kind of intense. That might be too much for your partner today, and that's okay. After that, what's our next step after all of our treatment before we stretch?
Friction attachments.
Friction! So we're going to be frictioning all along the SI region to the iliac crest and the greater trochanter. Greater trochanter is easy. You could just put a nice gentle fist on it. Just like all the other lower extremity activations. Keep it stationary. and you move your fist. You do your fingers, kind of like a twiddling around each other. Besides just treating this SI region and iliac crest, you're going to take it across the entire sacrum. We're only working one glute today, but please treat the entire sacrum. You're going to find that area using your knuckles, pull towards the muscle tissue. Communicate with your partner if they maybe go too low, because we're going to go till the glute starts to kind of tuck back under. We don't want to go too much further than that. It can be a little uncomfortable and a little invasive. Take it all the way around. You can use thumbs and do circular. This is one of those attachment sites you can spend a good while frictioning.
Is there a recommended minimum of frictioning, like we have with like
At least like a minute.
Okay.
Bare minimum if you take it further. If your fingers are okay. If it hurts you to do the thumb one, just stick to the knuckles. You know, don't hurt yourself in the process. You'll build your hand strength. So you can identify the borders of the sacrum. So that's your sacrum right here. I'm just going to use my circles, my fingers, and use little circles. Now you can go all different directions. I can spend a lot of time doing this. I can use a palm, twist, twist, and pull it down. Notice how I've moved my hands so I'm not just like palming her glutes that kind of come out. Fingers are on her waist. Her glutes are on here. My thumbs are now on her sacrum. Doing little circles. How's that, Hannah?
Feels so good.
Isn't it amazing? Delicious,
I have not been
right?
touched there like ever. I feel like
You'll be able to feel
great.
trigger points all through here as well. Adhesions. We call them trigger points, but it's not really in muscle tissue. It's in the tendinous areas and the fascia. So it's more like fascial adhesions. If you soften it up enough, you might be able to grab and skin roll. Can't do this on everybody. Is that comfortable?
Mhm.
Yeah. I wasn't able to do this a minute ago. You could even get in a little sacral stretch. Palms on the sacrum. Gently here between the shoulder blades. I'm gonna get real fancy with it. Comfortable with that?
Mhm.
And if my fingers aren't touching, this is just palm compression. Somebody has a disc herniation or a fusion, I wouldn't do that because we're actually like causing we're stretching out that lordotic curve. Golly gee, what else? Sacrotuberous and sacrospinous ligaments. You can hit these over the sheet or you can hit them under. You're going to come up those hamstrings up to that ischial tuberosity. So just medial and just compress in. Little circles, equal friction. If you want to palpate to locate them, find that ischial tuberosity, go up just a little bit and medial, very gently, because we're getting close to things. In this profession, we will get up close, but we will never, ever, ever get personal. But we're close. So ischial tuberosity is here. I went up and just medial, and I can feel what I'm on. It's different density than muscle tissue. Muscle tissue's got some good give. Bone, definitely, it's very hard. So speaking of end feels, soft, firm, and hard. So soft muscle tissue, firm ligament, hard bone. Same with compression. So my fingers have been on it. You can compress that way. I can find it with my finger. Go in with my elbow. Comfortable?
Mhm.
Compress for a little bit, just like you would on a trigger point, even though it's a big, thick ligament. Get a little circular friction coming off. something I don't always do on everybody